one word your team would use to describe you?
I'm a healthcare technologist.
And what's your hidden talent outside healthcare?
I'm a sitarist actually by profession.
And if you weren't in healthcare technology, what career would you have chosen?
To play sitar.
One destination on your travel bucket list.
Kashmir.
Hello, everyone. Welcome to the Beyond the Spotlight Leadership Series presented to you by Digital Tech Media. Today, we have with us Mr. Shuvankar Pramanick, CIO for Woodlands Hospitals, and he's going to talk about connected healthcare ecosystem. So his theme for this particular discussion is Vision 2030, one patient, one longitudinal record, one connected healthcare ecosystem. First up, Shuvankar, a very warm welcome to you. And I'd like to know, why did you choose this particular theme for your discussion?
Thank you. Thank you having me in this forum. It's a beautiful concept actually, and I'd love to share my thoughts. And back to your point, because we are in just 4 5 years to reach 2030, and how we are growing in terms of technology in healthcare domain, and the space, the kind of area we are covering in technologically, and process automations, AI enablement, and all these things is rapidly showing that we'll be reaching in a point by 2030 that where it will be a single platform, in terms of patient data, in terms of patients consents, in terms of doctors platform, clinical platforms, everything. So that is more interesting, and that is the end goal of this technology enablement in healthcare. That's why I choose this.
Okay, all right. Thank you so much. So that brings me to my, first question. By 2030, what is the single biggest barrier preventing India from achieving one patient, one longitudinal health record, according to you?
Oh, basically, there are a lot of things which we already, covered, and we crossed those barriers. Initially, 3 years back, we started this goal, and keeping focus that we should have a single platform for the patients all across the organization, because for the patients there are a lot of platforms available in any ecosystems, healthcare ecosystems. Like if I say this, maybe corporate hospitals is there, a lot of small nursing homes are there, independent clinics are there, government hospitals are there, and imaging centers are there, and home care, healthcare, telemedicines, teleradiology, all these platforms are there. The problem which we faced 3 4 years back first, like for each platform, we generally used to keep the patient data in different format. If I give you an examples, like patient has kind of diabetics mellitus type 2. Suppose one hospital is keeping in that format, it's a diabetics mellitus type 2. Someone is keeping DM. Someone is keeping same data in diabetic type 2. Someone just putting this data in a free text format. So for the patients, single disease, but multiple platforms, it's multiple narrations. So it's very difficult for the patients, also for the clinicians, also to consolidate the patients development of the particular disease. Keeping in this mind, we introduced is first single patient identity. Now, government is doing ABDM kind of activity, which is already covering this problem statement. Single patient identity all across this patient platform. Second, the challenges was that we should share this data in between, right? All this platform. In that case, IT in technology came like FHIR API kind of infrastructure, where this data can be flow in between very smoothly. third challenge was that the EMR adoptions, and we have seen a very significant, increase of the EMR adoptions in every platform, whatever I mentioned. So these three things and patient awareness. Fourth part was the patient awareness. Now patients are more aware about their data, their health record, what to share, why to share, everything. And before coming to the hospitals, even they Google it, they speak to they put it on Chat GPT, and they got this all these details of this disease. So they are very much aware. Now patient is very knowledgeable for particular disease, right? Uh, the main problem. So in terms of technology, everything is well set. The main problem is the clinical adoptions. Still we are struggling. Still we are struggling because of the the modus of operandi, one for the hospitals, yeah, for any healthcare organizations. Second, the mindset of the clinicians, the trust we are going to build into clinicians fraternity, that whatever is this technology is giving to you, it's not replacing you actually. It is just, justify your outcomes. So this is the way we are trying to gain the trust from the clinicians, so that they are more dependent on this kind of platform. Once this will be overcome, we will be overcome this problem statement, will be 100%, one patient's one record kind of goal.
Right. So coming to the second question, how can healthcare providers and technology companies, even regulators and payers, really collaborate to build a truly connected healthcare ecosystem instead of an isolated, digital platform?
It's I covered in the first questions more on part of this query, your questions what you raised. Uh, Mainly, everyone should work collaboratively. Uh, Not a single hospital's effort or a chain of hospitals effort will reach this goal particularly. So everyone now, insurance body, the payer part, the paying part, everyone should be well connected, and we are going in that directions only. We're not deviating from any point of this collaborations. Only things the participations of the private hospitals should be more of this government initiatives. Government is well focused and they know what to do, right? One is these initiatives, and this patient data should be more federal in terms of sharing, in terms of taking the consents, all these things. More federal patient data should be. So this belief should be there in the whole ecosystems. This is one way we are going in that direction. Second, it is my thought process. If we could have, EMR for the organization specific rather than EMR for the patients only. So if suppose I am a patient, I have a EMR platform, and you are also patients, you are at the same platform you belongs to. Now hospital has to engage with our platform. So if patient's EMR platform is similar, in that case, every hospitals, every organizations have to plug in that platform. Rather than different organizations have different EMR platform, and patient's data is plugging with all these platform. Better we should have a patient EMR platform where I will give the consent as a patient. I will allow some doctors to put prescriptions on my EMR. I will allow I will share my data with Dr. X and Dr. Y also. So it's my data. I can do whatever way. So EMR platform should be for the patients, not for the organizations. This is my thought process I put in. This could have been a plan B.
Right. So a related question, how do we balance seamless health data sharing with patient privacy, consent, and cybersecurity, especially in this era of, AI-driven healthcare?
So consent management system should be with the patients only. It cannot be a kind of, with the organizations, number one. Number two, then we can give the accountability, the responsibility of the patient data to the patients, not to the organization. Organizations will be responsible to keep those data. But accountability, the owner of this data should be the patients, which is not 100% done in Indian healthcare at least, right? And other than this, there are a lot of cybersecurity threats are coming because whenever we are going to, cloud infrastructure, we are going to AI-enabled infrastructure, the AI governance is not there. In that case, we will face a severe issues in the data security and cybersecurity part. So we have to be very alert when we are putting some technology to automate something, to control something. The technology should have its own governing systems. Otherwise, it's very difficult to, manage those data.
Right. Thank you so much for that insightful discussion. And that brings us to our, next section, which is the Beyond the Spotlight rapid fire section. I'm going to be shooting quick questions, and I'd expect quick one-worded or even a sentence long answer. So here you go. One word your team would use to describe you.
Me, I'm a healthcare technologist.
All right. And what's your hidden talent outside healthcare?
I'm a sitarist actually by profession.
Okay. And if you weren't in healthcare technology, what career would you have chosen?
I should have been focused on, something musical instrument like I love to play sitar.
Great. Okay. And one destination on your travel bucket list?
Kashmir.
Kashmir. Any particular reason?
It's a beautiful. I traveled there 3, 4 times, but it's a really beautiful place. Whatever place I have seen, it's a really beautiful.
All right. So the last being, complete this sentence for us. Healthcare in 2030 will be?
Healthcare in 2030 will be connected, you know, consent-driven, AI-enabled, and built around one patient's one longitudinal records accessible securely anytime and anywhere.
Right. So on that note, we come to the end of this discussion and this particular episode. Thank you so much, Shuvankar, for joining us today. We enjoyed this discussion thoroughly.
Thank you. Thank you, Puja.